Stephen Rick. I'm a fourth year now, PhD student in computer science. I actually joined the design lab when I joined the graduate program here at UC San Diego. My first work was in patient-provider computer interaction. We want to understand what is the burden or perhaps influence of the electronic medical record on patient-provider interaction, being that you go to the doctor, you sit down, the doctor looks at their computer, they will talk to you, they look at their computer, they talk to you, they look at the computer, they talk to you. They wind up splitting half their time, between the human and the technology. In some ways to the advantage of the human, in the sense of like checking your labs and placing medication orders and figuring out a care plan, but in some other ways to the detriment of the human in the room. And so we want to understand why are these things happening and to what extreme and when and where. And then that work pivoted into the space of sort of more generally looking at how do we better equip providers with technology that support them. So we did some work in the space of trying to make sense of symptom detection in like the emergency department, where if someone comes in and they're suspected of having suffered a stroke, and there's only one neurologist on staff, and there are 30 patients waiting to see them, can you triage folks faster? Can you look at sort of the signals that they're exhibiting out into the world as they sit there waiting to be seen? That helps you say, hey, this person needs to be seen sooner, and try to accelerate that process. And then finally, more recently, looking at how can technology really go from being a tool for assessment like symptoms, or a tool that doctors use to do their job, to more of a teammate that works with doctors and with patients. So it's done a bit of work in the space of offloading the burden of clinical documentation through automatic systems that can listen into the conversation between patient and doctor, and try to intelligently make sense of that and capture that in a way that allows the doctor to quite literally focus on the human in the room instead of the machine.